Good morning, good afternoon, and good evening, everyone. Welcome to the AMO Physician Panel, an in-depth exploration during the COVID-19 era and addressing the needs of telehealth and the U.S. healthcare system. I'm Dr. Andrew Albert. I have been working with AMO for 4 years. Happy to moderate this session and joined by some excellent speakers. I'd like to now ask Dr. Lin to introduce himself, and we'll go ahead and make introductions.
Hi, everyone. My name is Dr. Samuel Lin. I'm an associate professor at Harvard Medical School, program director of our plastic surgery residency program at one of our Harvard teaching hospitals. I'm an AMO preceptor, as well as co-founder of IMG Match, which is a consultancy firm helping folks match within the U.S. from international medical schools beyond.
Hi, everyone. Really great to have you all here listening to us today. My name is Austin Chen. I'm actually an incoming PGY1 or intern at the Mayo Clinic for Plastic and Reconstructive Surgery. Also a co-founder with Dr. Lin in regards to IMG Match, which is a consulting firm, as he previously mentioned, to help international medical graduates match in the United States.
Hi, everybody. I'm Ben Bradley from AMO. I'm actually the co-founder of AMO and chief operating officer. If you've watched some of our lives before, you may have seen me. Have worked in health policy for a little over a decade, and I'm responsible for helping you all get your clinical experiences, visa, housing into the hospitals. So happy to be here and contribute as a non-physician. So back to you, Andrew, and we'll kick it off.
Great. Thanks, Ben. So many of you across the globe have been interested in pursuing rotations here in the States, and there is plenty to talk about in this series and other lectures beyond. But I think it's important for us to share with you a little bit about what our American medical system is like, what the day-to-day is like, what rotations are like. I should tell you that many of the rotations are different, and they could be whatever rotation you're really looking for. There are various types. I'm going to let Dr. Lin and Dr. Chen speak to what their experiences have been precepting, and I will follow up with my own personal experience as well. So go ahead, Dr. Lin.
Sure. Thanks, Andrew. So, obviously this is, we're living through history, of course, every year, but this year in particular, it's really an extraordinary year where it's tough. The applicants and the programs can't really connect. And in that manner, the applicants can't tell the programs that they're interested in them. The programs can't tell the applicants that they're interested in them. So hence, everything is indeed virtually through virtual consults, and also in terms of patients as well as rotations. So that's primarily, as you can see, a lot of how things are being done for this year and for the near future for sure. So it's really kind of getting your experiences and figuring out what programs are being offered in the different fields at different hospitals and residency programs.
Yeah, so thanks, Dr. Lin, for kind of, talking about the current kind of situation that we're in. So I'm going to kind of take a little bit of a step back since, I'm recently a matched, resident coming into the American system. So I'm originally actually an international medical graduate, graduated from Taiwan. So shedding a bit of light in terms of my path, my experience with the rotations, both in Taiwan and the US, and how I think they kind of change, especially with, COVID-19 and the transition to telehealth. In Taiwan, I'd say, technically speaking, if you're talking about from patient care and in regards to the different diseases and things that you'll see, I'll say that you might not experience that big of a difference with the US and your own home country, unless, you're in a specific region, let's say a tropical region, you might have different infectious diseases. But I'd say the biggest difference is in regards to, the expectations that I think the US system does have in terms of for the medical students as well as their rotators versus potentially in your own home institute. I'd say, from my personal experience in Taiwan, our rotations were more so, you come in, you're kind of still a student in some senses where, you go to lectures and you see patients, but it's not as, I feel like engagement-wise, I think the US, they do expect students to be much more direct, much more engaged in terms of patient care. I'd say, my experience in my first rotation in the US, a lot of it was, kind of a culture shock a little bit in terms of what was, I was allowed to do actually a lot more than I was able to do in Taiwan, which you might think is kind of strange given that, there's a lot of thought about how I guess the U.S. is restrictive in terms of, letting students do certain things, et cetera. And I think that's like probably the biggest, from my point of view, I think that's the biggest thing that's missing in terms of telehealth, and that kind of those kind of rotations. But at the same time, you have to think about the fact that a lot of the rotation is also getting to know you as an individual. I think that's really where telehealth actually might help in terms of getting you FaceTime directly with the attending physician and as well as the resident team. That actually makes it it's a different kind of experience, with positives and negatives based on kind of what I went over. But I think there's a lot of value and potential moving forward with this.
Yeah, I agree. Did you want to say something, Dr. Lin?
Yeah, I would just say one thing regarding the rotations that we see from students all the time is just how the U.S. is a private payer system, mostly private payer, mixed system really, how kind of the U.S. medical system is affected by cost pressures. And, speaking, Austin, to what you said there, a lot of times, when we're working with practices and things like that, a medical student who's in is expected to actually carry their weight because, this may be a privately owned clinic. It may be a hospital that's operating under certain cost pressures. And, a lot of you watching may think maybe you're doing primary care in your own country and that primary care is done at the hospital. You walk in, you see an internist at the hospital. One of the biggest pieces of culture shock we always see is when somebody, for example, goes to a pediatrics rotation and it may be with the chief of pediatrics at a top teaching hospital, and they do most of their practice in a clinic, and then they may go see inpatients, admitted patients, but the U.S. medical system, because of costs, has actually moved so much of practice outside of the hospital. So there are just things like that, because we are truly kind of a unique mixed system that I think affect not only your rotations, but just how you practice as a physician and as a medical student all the way up through residency into an attending. So just something to keep in mind.
I'm going to add to that a little bit, Ben. In the experience I provide for the students that I precept, I throw them in. Some of them want to be thrown in, some of them don't. It's really up to them. But I basically have a clinic, and every 15 minutes or 20 minutes, there's another patient. So I have my students go in the room, take a history, and then I ask them to present the case. Of course, when they start talking about the lungs, when we're dealing with a GI practice, I have to redirect them a little bit. But the truth of the matter is that we give students pretty much as much autonomy as they want to have, with the exception of doing colonoscopy on my patients. I really let them do what they would like to do. In addition to the clinic setting, there's also the hospital setting, the setting where the student goes up and rounds on in-hospital patients. And so the experience can vary from clinic to hospital. And then there's some also community education components as well. So it really is a well-rounded rotation. Let me shift gears a second and just ask others how COVID has changed how you precept and what you're offering to students in this COVID-19 time. So go ahead, Sam.
Yeah, of course, as we're talking now, of course, everything has switched to online platforms. And I'll just highlight something innovative that we've done, in our hospital with the help of one of our own fourth-year Harvard medical students who basically in May, with her help, we designed a virtual curriculum in May, which piloted out to about 20 students broadly in the U.S., just basically giving them a sense of plastic surgery for a month with a curriculum. And that's sort of, we opened it up in June, and about 380 students signed up from all over the world as well. So in stateside in the US, probably a little more than half of that. So it's really kind of been something that's burgeoned and really, I think for the most part is here to stay. So obviously telehealth and virtual rotations are established now. They're here to stay. I would say even in my own practice, virtual visits are going to be here to stay, just given the nature of the fact that we can't see as many patients because of the whole traffic folks coming in and out of the clinic. So that's something that's definitely changed for good. And I think for the better too, because it obviously saves costs for students not having to travel all the visa issues. Although I saw from the presidential proclamation today that H-1B, J-1 visas, they're all kind of preserved. So that's huge for you guys. And I can't emphasize that enough. I mean, that is really something that is thankfully something that's being preserved for all those folks who are interested in rotating or trying to stay in the country and get and match within residency.
Yeah.
And I will just, sorry, Austin, before you jump in, just one thing. To our viewers out there, your B1 visa processing is not impacted by presidential proclamation. And the like Sam said, also H-1B and J-1 for residency not impacted. So feel free to reach out to our email if you have any questions on that. And back to you, Austin. Sorry for interrupting.
Yeah, just hopping on a little bit in regards to telehealth in that sense. I think from the I guess student or applicant kind of perspective, I think a lot of you probably worry about, if I don't get hands-on FaceTime, spend actual time in the hospital, like what am I going to do? Is this going to be enough for my application? Is this enough where I can gain enough clinically? But I think as Dr. Lin mentioned, this is something that's I guess one is like it's had a massive impact, not just I guess for the international community, but also for U.S. graduates and applicants. U.S. medical students right now, at least in plastic surgery, most of them can't do rotations as well. It's all either through a virtual kind of curriculum, like you mentioned, or some kind of telehealth kind of rotation that they'd have to do. So it is I guess a shift in terms of the medical education in the U.S. as a whole, and not just I think one facet that impacts international medical graduates. Rather, I think. Just speaking from if I was, in your shoes, I think it's actually a benefit, right? Because you're able to save costs in terms of, flying over. You actually get to talk more with the actual team versus, kind of doing different work that, you're expected. I mean, obviously you're expected to do as a clinician, but, it's a different experience, but, I think it kind of levels the playing field in some senses.
It really does. This is, among other things, the pandemic has really equalized a lot of things, for better or for worse.
Can I ask you, Sam? What are you gonna do? For your residents, your applicants coming in, are you looking at? Do you believe in the value of a telehealth obtained LOR? So you are taking that into consideration.
So for U.S. students and whoever, but rising fourth years who are applying now this cycle. We've struggled and we've been watching the landscape of different programs doing what they're doing in terms of outreach, social media, what have you. It's interesting because there's been fits and starts with certain programs, and I think ones that are doing them, I think better than others, and certainly for the most part, it's interesting. Like there is a sense of overdoing it. Like these poor medical students are going to be on Zoom like. Literally, there's on Zoom every night. There's an event by some program in plastic surgery that is every night, Monday through Thursday for the next 3 months. I mean, talk about an overload. I mean, what are you really getting from that? So it's really trying to curate and really kind of getting to know. I mean, trying to get the individual programs. So we're kicking off sort of a version, sort of for us, in the summertime. Again, not to hit people over the head, but just really trying to get to know our program in particular. But in terms of rotations, I mean, people have offered 2-week virtual curriculums. That was prior to the opening up of many states, frankly. So it's really not feasible to be on Zoom for 6 hours a day now because everyone is opening up. And so it's really still just trying to do some outreach to help people get to know each other.
One thing I'd like to add to all of that is that everything has been moved to Zoom or some other modality. And so whether it's a tumor board or whether it's a multidisciplinary lecture, things are now online. So you don't necessarily have to physically be in all these places because it's all virtual now. So you could be at the tumor board from 7 to 8, but then you could be in the clinic with me from 8 to 12. And then you can go with me to my free clinic in the afternoon from 1 to 5. And so it's almost like I could bring the student with me or all students with me and have like a grand rounds on my laptop as I go through lecture to lecture to lecture with the entire group. And so that's
it's really amazing. I think it really has helped education, obviously level the playing field, but and also help students who don't have a primary, for us at least, primary plastic surgery rotation. Even in the U.S., there are just medical schools that don't have Pilates students or academic Pilates students who can offer a rotation. So it really, I think, has helped people at least understand what the field is about, and maybe other fields as well.
Agreed. I also think this allows us as preceptors to get a sense of the students, because it forces them to interact with the patient in front of us. So then we get to actually critique them. And then we can have a session with them, like you had mentioned, Sam, with the multiple hours. We can have another hour going over and critiquing their interview skills, their presentation skills, their differential diagnoses, and have a didactic session. So I feel like I allow longer visits with my patients now, so there's a lot more room to review because the whole session just, is longer.
I was lucky, I guess, I was able to escape some critiquing, like doing stuff on the wards and being the OR. You can kind of escape, some of the, I guess, upfront, under the watchful eye of the preceptors. But
well, I agreed. I think though, if you're looking for a letter, that one-on-one time with the physician getting to know you, it actually gives you more face time, literally, with the physician.
It does.
Rather than go disappear into the room for 15 minutes and report back. The attending is with you the entire time. It's a lot of close time. So
I
Andrew,
totally agree, Andrew. Yep, absolutely.
We have a question. I'm sorry. Go ahead. We have a question from the audience, and they want to know: are these telehealth rotations, are they actually being considered electives in the U.S. system? So I guess even cores I've seen, but can you guys speak to, for instance, at Harvard, these are actual programs that are being offered as part of medical school curriculum, correct?
So that's a great question. So to be clear about all this, several months ago when this all hit with COVID, that was posed to all the fields, and what the medical school basically decided overall for all the schools, all the 15 hospitals and clinics, was that virtual rotations would not be official curriculum and courses because of the fact of privacy thing. So it's different in every state, every city, every state type of thing, mainly because of the fact that, for instance, in plastic surgery, obviously the exams are pretty sensitive areas, and then who's consenting for these things? Can these videos sort of show up anywhere? So all of these have been basically organized as far as all across the board as well, sort of unofficial virtual rotations and curriculum that we've been generating just because for different reasons, for educational purposes, of course, for outreach in terms of residencies, and it's essentially what we're able to kind of offer from where we are.
Yeah. And I've seen it's very school based, at least from our partners. For instance, not at Harvard. There's another. I won't say the name of the university in Boston, but we received an OBGYN core clerkship manual. 18 pages for their OB-GYN core. So when a student is asking, is this something that can be considered for credit? It's all based on your home school. So when you're talking to AMO and you say, I want to take this rotation as an elective, I know it's virtual, can I use it for elective credit? What we would say is, why don't you give us somebody at your school to talk to? We can describe the rotation to them. We'll get that approval first before you pick a program, and then you can reserve. So it's all dependent on the school.
Right. So I just filled out a form for a visiting telehealth student in July for her clerkship for her medical school, and so I think that can kind of work for her credits.
Exactly. Right. Oh, Andrew, you're on mute.
Just kidding. I'm pretty confident that the content that students will learn is going to be substantial and even more than before, especially with the required reading that we may assign if they're interested. So I guess that's semi-required, or the multiple visits and clinics and conferences that we go to. How do you, Sam and Austin, feel that students should position themselves if they're doing an elective and it's approved? I would suggest that students ask for one-on-one time with the patient, or find a way to present the case or present the topic. How can students use this precepted opportunity to strengthen their application if applying to the U.S.? Because that's not going to stop, right? We're just moving to a different venue, if you will. Tell me, each of you, tell me what your thoughts are. So, Sam first.
Yeah, why don't you want to take that first?
Oh yeah, definitely. I think, from my perspective, I think, one is, as previously mentioned, doing the telehealth rotation actually gets you more face time, versus, like, for example, just from my experience rotating in the US, I mean, one benefit is that they get to see you in action in terms of, showing up early, going home late, et cetera, putting in the hours, putting in the work, working with the resident team. But I think with the telehealth rotation, then you actually just get direct time with the faculty, which when you're actually doing a rotation in the US, you actually might not get. You might see them for a couple minutes at a time, but they get a lot of their information from the resident versus directly from their interaction with you. And I think positioning yourself to do well in these rotations, a lot of it is being, I want to say direct, or I'd say first asking for their expectations, right? I think, that's one very important thing. I think, for a medical student, whether you're a US graduate or an international medical graduate, I think, one is just making sure that you understand what's expected of you from that preceptor. Sometimes they might not know, right? Sometimes they might be like, oh, okay, you want to just, follow me around and do things. But at that point, you can always chime in and say, hey, I want to learn these things. For example, if there's a patient coming in, it's like, do you mind if, I can, I don't know if it's, for the programs, what they're doing exactly for that, but you could potentially do a patient history via the virtual kind of platform with the preceptor there. I think that'd be a great opportunity, one, to showcase kind of your clinical skills without, actually physically being there. And at the same time, it's a great way to, segue into a discussion about that patient, further management, et cetera. I think that's really, that first step in establishing that relationship where the attending and faculty can kind of see, hey, this person, kind of knows what they're talking about. I mean, as medical students, you don't always know or think you know what you're talking about, but you can, put on that face on, or that mask for people to look at, and that kind of builds that relationship. I think once they get to know you, trust you a little bit, and see that, hey, that kind of builds that camaraderie and that kind of mentorship with the attending. Yeah.
Great, awesome.
Yeah, I couldn't agree more. Austin basically described his rotation with us a couple of years ago. I mean, the reality is that we're all, everyone's busy, everyone's running, from case to case, and just trying to get the day on, seeing patients, getting the cases done in the operating room. In our rotations, we're definitely a lot of, for the folks that are rotating and on service with privileges, it's hands-on. They're scrubbed in and they're helping, doing a lot of stuff under supervision. So oftentimes it is, limited in terms of face-to-face interaction, which is totally different from, for instance, this telehealth curriculum, monthly curriculum that I designed. So it has didactics, obviously, and case discussions that I'm going to be running, and so it's a lot more and dedicated time too. So it's not the same as trying to grab a couple minutes, between cases and things. So it's just a different feel for sure. But I would say for the students, any FaceTime and getting to know people is valuable. Really, it's just it's so much different, obviously, even if it's virtual, and you can learn a lot, of course, from both ways in terms of people just by interacting with them on over a virtual platform, and it just saves a lot of time, energy, and cost, obviously, for students.
Those are all great points. Adding and dovetailing on what Sam and Austin said, it's interest. That's really what one of the biggest components is just showing interest, or showing that you're paying attention to what's going on in the room. Sometimes I'll be in a rotation and I'll, obviously not an AMO student, Ben, but like I'll turn around and I'll see them on their phone the entire time while I'm having a conversation about delivering a cancer diagnosis, and I'll think, oh, such a fail, like this is important. So I honestly think it's about showing interest while you're there and asking a thought-provoking question, or if you don't know the link between colitis and lupus, or colitis and, I don't know, cholangiocarcinoma, that's the time to say, hey, do you want me to look up the latest on the association between the two? So suggesting perhaps an area that you can look into for the physician is also a way to show that interest, so that when you ask for that letter, they remember you as far as making a concerted effort.
Yeah, I think just hopping on that for a kind of funny story. So when I rotated with Dr. Lin a while back, about 3-4 years ago. Actually, no, it's about 5 years at this
Has
point.
it been
But
5? Wow.
yeah, it's been 5.
Time
Five
flies.
flies.
He actually quizzed me on the anatomy of the nose. I remember that very distinctly. And I only answered like a couple questions right, but here I am. I survived somehow. But I did go home. I read up again, and then he asked me the same question actually a couple of days later, and I got them all right. So I think part of it's also showing, that.
Against, and maybe you can share your
Sure.
your experience a little bit.
Austin, you want to?
Yeah, definitely. So Dr. Lin and I actually, we're also co-founders of a consulting firm, IMG Match, that works with AMO opportunities to kind of build that connect between clinical rotations as well as applying to the US. And I think a large part of what we kind of establish is really, I think mentorship is that key component that is lacking, I think, a lot in terms of, for an international medical graduate to come to the US and really figure their way of applying, coming from a different country with different expectations, different rules. So I think, what we've tried to do is really bring that forward with a group of, excellent kind of consultants that can provide this information based on whatever your end goal is, whether it's, applying to internal medicine, whether to a surgical specialty. We have people who have actually gone through that path as an international medical graduate and Match. So we're trying to build that network and connect you with those people to really facilitate the best possible application process for you. But
yeah, and I think that there's a lot of there's a lot of firms out there, but this is really the only one that is made up of folks primarily who have talked the talk and walked the walk, who have been who've graduated from international medical schools, come to the U.S., done rotations with companies with AMO, for instance, and then matched successfully in residency. It's a long process and daunting one, and trying to make that process a little easier with really strong and longitudinal mentorship and coaching.
So if I could just interrupt you here for a second, Andrew. So I guess I have my first mentoring opportunity for you guys from the visitor questions. So there are a lot of questions I think that we've touched on. You've touched on this baby being an equalizer, this telehealth and COVID situation, but with the ECFMG pathway changes for Step 2 CS, can you? I know you're not the NRMP, but maybe talk a little bit about how you think that will affect an IMG's chances in the match. Is it going to be easier, harder? Will they struggle to differentiate? Will it be easier? Maybe just talk generally about how you see things going with kind of fewer dimensions to differentiate yourself on.
Oh, I can take this first.
Sure.
So I think, from my perspective, as an applicant in the US, a lot of it is, you're really focused on step scores, right? That's the first thing that you see. You search anywhere, you talk to any person, they're like, oh, you need a fantastic Step 1 score, a Step 2 score, Step 2 CS. But, with the recent changes, not only for Step 2 CS, now with, COVID-19 going on, Step 1 is also, undergoing massive changes to becoming a pass-fail kind of system. I do think it's a double-edged sword in some ways. I think, one is obviously if you can and know that you can get a great Step 1 score, that's only beneficial for you. I think, no one can argue with, great score or great exam scores in that sense. But on the other side, if you know that you're not a fantastic test taker, this actually, I think, if anything, it can help you in some senses where, now the focus is not only on, I guess it kind of shifts the Step 1 focus away a little bit. And, who knows how programs are going to change. Some of them might focus on Step 2 CK. But I think for the majority, a lot of it's going to be really focused on one, clinical rotations. I think that's going to be a big facet. And I think, with AMO opportunities, that's a great way to kind of hop in and really get to see, different preceptors, different programs, because people are going to look for people who they know. When there's fewer things to look at, fewer variables to look at, they're going to look for a sure thing in some senses. So clinical rotations definitely is going to, I think it's going to skyrocket even further in terms of that letter of recommendation, that actual, personal interaction that you've made during that rotation. I think another part of it's also really having an established game plan and kind of a mentorship system in place where, I think a lot of what you hear in terms of applying might not actually be true when you actually apply and you go through the process and actually find out. So I think, step one, it really depends based on you as a person. If you know that you can do a great job on the exam, this might be something that kind of hurts you a little bit because you can't differentiate yourself there. But on the other hand, if you're not a great test taker, you can, differentiate yourself through other things such as research, such as the rotations you do. All these things, play a huge factor in this.
Yeah, I think that, again, as another equalizer with this pass-fail going away, certainly program directors, programs will be looking at your applications from really more of a holistic point of view. So it's really, there's no, when I look at applications, there's no magic about it. It's everything that you turn in. It's the letters of recommendation, it's the research, it's where you're from. Certainly, if it's pass-fail, then there are other metrics to kind of go off of course, but you would think that everything else becomes more important, of course, if they're taking away one component of that. But bear in mind, just like Austin said, it's just one factor. It's not the only thing. There's lots of opportunity for training in the U.S. Really, I mean, if you look at the numbers of places, there's thousands of people. They've done it, but I think there's also always uncertainty and helpful to kind of develop some mentorship and coaching along the way to make that path a little smoother.
Yeah, I agree with all those points. I think really when it comes down to it, your clinical experience with that one preceptor in the rotation really matters. Yeah. And AMO has worked to create this outstanding telehealth rotation with access to some incredible physicians. And then there's us, well, there's me, but then these outstanding physicians. But the truth of the matter is that the rotation you're looking for, you can create. And what I wanted to also emphasize is that you can create the rotation as well. You need to tell the attending up front what it is you're looking for, what it is you're looking to do. And you can create an out-of-the-box experience if you work with the attending and talk to them about what your goals are, your hopes are, whether it's plastic surgery, GI, or pediatrics, or whatever it is. But if you can communicate that to us, that would be fantastic. And AMO will give you that foundation and support you to do these awesome, wonderful things. You just have to come to the table with some idea of what you're looking for. So well, I'll leave it there. Any other points people want to make?
Well, I just will say on this one point here, I think one aspect that we've heard from other directors and students in the past, regarding the value of the clinical rotation, it isn't just a letter. It's practice for things like your interview. It's stories to tell during your interview. Being able to go in and say, I worked in an ER for 4 weeks. I came in, maybe my English was good in a class, but I had to learn English in an ER. And maybe you talk about some of the things you had to do, kind of pick up on the fly, some of the changes, you saw from your medical system to the US. And, you're talking about a situation where you have fewer places to differentiate yourself. If you get that interview, you're going to have to need something to talk about and really go in and show that this is a person that I can trust bringing into my residency program, that I'm going to like, that I'm going to want to spend time with. I think that's a very underrated aspect as well. So, the clinical rotation is not just the letter. It truly is the experience. It's the ability to talk about your time in the U.S. and show how you can add value to any residency program.
Yep, exactly.
Well, in respect for time, I think, yes. Ben, is there anything else you want to add before we wrap up here?
Yeah, I think at the end, so one thing to our viewers out there, I know a lot of people were requesting a certificate of attendance for this panel. We're very happy that you are requesting this, so thank you for that. But you will be able to download that on the landing page and the exit page. And if you have any questions, you can't find it, just email our team. I want to just talk briefly about kind of what AMO is offering during COVID, and then I want to give the IMG Match team just an opportunity to kind of talk about their services, where they're going, and how our two companies really fit together. So right now, AMO is offering online telehealth rotations. I think it's kind of interesting because when you think about this, there's two types of these. One is where you're on a Zoom, physician's on a Zoom, and the patient is on a Zoom, and you're all talking. You may have the opportunity to do a direct, history taking, case presentation, differential diagnosis. The other opportunity, which we actually have at ACGME Green Book sites, is where a physician is in a room with a patient, and we've got a secure EMR feed, and you can actually be in the room virtually, and you can look at EKGs and that sort of thing. So we're really trying to build out programs here that give you the most amount of choice, while also trying to capture as much of that true, person-to-person experience, in this limited COVID environment. The second thing I want to say is we do have clinical sites open. So if you're in the U.S., you have a visa, if you're able to obtain a visa and come, we actually have a process with our programs team where we're surveying and checking in with every single site, looking at the COVID exposure in their area, looking at their specialty. Do they see COVID patients? Do they have sufficient PPE? Do they have a screening process in place, pre-screening? If there is a COVID patient, do they have a process to make sure that student isn't exposed to a COVID patient? And because of that, we're able to, keep a good portion of our sites open. And so for those of you that are able to attend, you have the ability to travel to a site, you do have sites available. Most of those, and I'm sure, Sam and Austin can speak to this, the hospitals are slowly opening. It's very regional. So if you are, uncertain about a particular state, maybe you want to go to Florida, maybe you want to go to New York, please check with an advisor, check with our success team. We're going to help you find a site that meets your requirements and keeps you safe. So that's kind of where we're at. I encourage you to reach out to us, and I will pass it to Sam and Austin to kind of just wrap it up on IMG Match.
Yeah, so thanks Ben, for kind of introducing us again. So IMG Match, as we kind of previously mentioned, is a consulting firm, but more so in regards to the actual services that we provide. One of them is obviously consulting in terms of providing, either developing a game plan for you, deciding what rotations to do, whether it's, before you've even considered applying to the US, maybe years before, and you're deciding, oh, should I do this rotation? Will this help me in the future? As well as, even after rotations, where you're trying to decide which programs to apply to, as well as, what's like, perhaps you're unsure about an email to send for research and things like that, little things like that. It's everything that we encompass for our consulting. But apart from that, we also do application editing, CV, resume, personal statement editings in that sense. So really an all around kind of package in terms of really trying to maximize your success in matching to the US, especially coming from an international background. But yeah, Dr. Lin. Yeah.
No, it's great. And it's really deep coaching and mentoring. Not only obviously we just happen to be in a surgical specialty, but really consultants that would match from all fields, from medicine, pediatrics, radiology, pathology, folks that we have on board who have gone through the path of graduating abroad and then coming to the US, and then matching and then staying obviously in the US. So sort of a full service sort of enterprise, and certainly that's great, Austin, for summarizing. And thanks, Ben, and then for this panel.
And I will just say, to the visitors out there that, I've been speaking with for almost a decade now. I know this is something that many, if not all of you, have been looking for. And, AMO, we're very particular about who we partner with. And we know that our specialty is setting up and running these great rotations, making sure you get what you need. And when you come to us with, questions about rotations, which one may fit better, we're very great at advising you, hey, this is a great rotation. But we wanted to partner with IMG Match because we know you're looking for something holistic. So you come to us, you're looking for rotations, but maybe you're not sure what your chances are at a certain residency program, or maybe you're not prepped for an interview or something like that. IMG Match is a great company to go to with, clearly both Sam and Austin, top level programs, great journeys. They know their stuff. So, if you coming to us with questions, we're going to answer them about the rotation. Our advisors, top notch in terms of getting you the rotation you need, but it really is a holistic journey, and it can't just be the rotations. It has to be the mentorship, has to be the CV editing, how to draft an email. It's so important. So I think the synergies between our two companies are great, and we're really excited about the future. And last but not least, Andrew, Dr. Albert, thank you so much for moderating. And I will say, this was his idea. He is consistently one of our top-rated preceptors. His students can't say enough about him, and we're so happy he can be part of the AMO team. And we're hoping this is the first of many great physician panels. So thank you, Dr. Albert, for hosting.
My pleasure.
Andrew, great job. This is fantastic. A lot of great information.
A lot of fun.
Awesome. Well, thank you all. And we'll have to brainstorm on the next topic for the next lecture in the series. But for now, we'll end it there. And please, everyone direct questions to AM Opportunities, and we'll go from there.
Stay safe, everyone.
Yeah.
All right. Thank you. Bye-bye.